chooses who has the right to live? Is it the mother? Is it Congress? Is it the church? Or is it you? Some of you may believe that abortion isn't about a mother killing her unborn child, while some of you in here may think that it is, like me. Today I'm going to talk to you about why I choose to be pro-life. I'm also going to go over some of the different types of abortions. MedlinePlus.gov defines an abortion as a procedure to end pregnancy. It uses medicine or surgery to remove the embryo or fetus and placenta from the uterus. Everyone in here has one thing in common. We are all alive. A living thing is defined as something that is growing, developing, responding, moving, and functioning. A baby does all of these things. While a baby is inside a mother's womb, they are growing, developing, responding, moving, and functioning. A baby is also burning food and oxygen just like we are. A baby at 12 weeks has fingerprints, moves around, and wiggles his little toes. But some people would like to say that it's not a living baby yet. It's just a pile of tissue. A lot of people argue that a woman should have control of her own body. And while that is true, when it comes to women demanding control of their own bodies, control should include preventing the risk of unwanted pregnancy by the use of contraception, or the way to completely prevent it, which would be practicing abstinence. The type of surgical abortion procedure used is based on the woman's stage of pregnancy. A few different types of surgical abortions are aspiration, dilation and evacuation, and dilation and extraction. Aspiration abortion is a procedure that is done during the first 6 to 16 weeks of gestation. It is also referred to as suction aspiration. This is when the doctor will put a plastic tube, which is a suction device, in the uterus to suck out the fetus and the placenta. Dilation and evacuation is a procedure that is performed after 16 weeks gestation. This is where they dilate your cervix using a synthetic dilator. The doctor uses a curette, which is shaped like a spoon. The lining is scraped in order to remove all of the baby's body parts out of the mother. And if there are parts left over, then they are sucked out by a suction device. Dilation and extraction is a procedure that is done after 21 weeks gestation. It is also called partial birth abortion. In this procedure, the mother's cervix is dilated so that her water will break. The doctor uses forceps to grasp and pull the legs and shoulders of the baby out of the birth canal. They then cut through the baby's skull to suck out the remains of their brain. All of these abortions are painful to both the mother and obviously the baby. The one I want to focus on more today is dilation and evacuation. While they are all very disturbing to me, this one really stuck out to me. I'm going to show you a video of the procedure as it is administered.
Once the woman's cervix has been dilated, which is a 2 or 3 day process requiring 2 trips to the abortionist, forceps are inserted through the enlarged cervix into the uterus. The body parts are grasped at random with a large, long-toothed grasping clamp. With the large, long-toothed grasping clamp, the abortionist twists the calcified limbs and other body parts from the unborn baby, and pulls them from the baby, which is capable of feeling pain, and proceeds to pull the calcified body parts out of the vaginal canal. The potential for injury to the woman can happen during this procedure. The remaining body parts, with the exception of the head, are grasped and pulled out through the vaginal canal. During this procedure, perforation of the uterus is possible. The head is then crushed in order to remove it through the vaginal canal. The placenta and remaining contents are then suctioned from the uterus. The body parts must be reassembled outside of the mother's body to be sure all was removed from the womb. If some body parts are missing, then the abortionist must continue to search for the missing body parts and retrieve them. At a gestational age of 20 weeks, the mother has been feeling her baby kick for the last 2 weeks. The child's heart is beating, and this can be seen on the doctor's ultrasound device. Eyebrows, eyelashes and fine hair appear. The child can grasp with his hands, kick, or even somersault. Under normal circumstances, a child could live outside the womb with intensive medical care. At 20 weeks gestation, the uterus is thin and soft, so the abortionists must be careful not to perforate or puncture the walls of the uterus. A second trimester dilation and evacuation abortion is a blind procedure. The baby can be in any orientation or position inside the uterus. The toughest part of the dilation and evacuation abortion is extracting the baby's head. The head of a baby floats freely inside the uterine cavity. The skull pieces must then be extracted. Some abortionists have reported that on bad days, a little face may come out and stare back at you.
As you can see, these procedures are very gruesome. Worldometers.info reports that abortion was the #1 cause of death in 2018. There were more than 41 million children killed before birth. This means for every 33 live births, there were 10 infants that were aborted. There are so many families who are wanting to adopt children. Choose to be pro-life. Abortion is not the answer.